Hello and welcome to another talk brought to you by physicaltherapycontinuingeducation.org. On the phone today I have Dr. Stanley Paris. Dr. Paris is a pioneer in the area of physical therapists using manual therapy. Dr. Paris is a fellow of the American Physical Therapy Association, an honorary fellow of the New Zealand Society of Physiotherapy, an honorary life member of the New Zealand Manual Therapy Association, an honorary life member and founder award recipient of the International Federation of Orthopedic Manipulative Therapy, a fellow and honorary life member of the American Academy of Orthopedic Manipulative Physical Therapy, and a member of the Chartered Society of Physiotherapy in England. If that wasn't enough, Dr. Paris is also the founding president and chairman of the board of directors at the University of St. Augustine for Health Sciences. It is a great pleasure to welcome on the line Dr. Stanley Paris. Dr. Paris, sir, how are you doing today?
Oh, I'm doing good. Just came out of the gym where I'm doing some hour and a half of exercise.
Oh, fantastic. Well, thank you very much for agreeing to talk with me today. And what I was hoping to do was tap your wisdom on manual therapy, particularly of the cervical spine. But before we dive into that, I'd just love to, if you could share with us just some of the history of our profession, being one of the central figures for the development of manual therapy in physical therapy. Could you tell us a little bit about the early days? For example, what sparked your interest in manual therapy, and what prompted you to seek out the guidance of people such as Dr. James Cyriax and Freddie Clayton-Bourne, and maybe mention your interaction with some of the other kind of key figures such as a Jeffrey Maitland, Robin McKenzie, Brian Mulligan, or any other people that you think were key who I haven't mentioned?
Well, that would take all day, but I'll give you the brief one, and please interrupt at any time.
Okay, that sounds great.
My father was a physical therapist. In fact, he was the first male therapist in New Zealand. In those days, it was a 6-month course to become a masseur and medical electrician, but that later became what we know today as physiotherapy or physical therapy. He had his office his rooms at the front of the house, and so he was treating patients there at our home. So I grew up knowing physical therapy, and then my sister came down with polio, and she required a lot of treatment over a number of years, finished up having Harrington rods placed in her spine by Paul Harrington. So again, very much in our family was physical therapy. I went into physical therapy because I didn't know what else to do, and you had to make those decisions back then straight out of high school. But Dad seemed to have a good style of life. He was respected, seemed to help people. I thought that would be okay. It wasn't long into my career, about 6 months, I had an incident in the gymnasium where I was teaching a class of about 12 people with back pain. And a lot of therapy in those days was done in classes. And I asked this man to put his right leg over his left leg, and he couldn't do it, so I gave him a shove. And his back cracked, and he was frightened, I was frightened, and I got disciplined. And that was on a Friday. On Monday, he didn't show up for classes, and I was frightened that I really had caused him some harm. But he walks in 10 minutes later and shakes my hand, thanks me for helping him significantly. So I then discussed this with my father, and my father said, well, that's what manipulation is, and that's what you did to him. And I said, well, where can I learn that? He said, well, you won't learn in physical therapy school. And I said, well, who does it? He says, chiropractors, and they're my biggest competition. So I then said, well, maybe I want to be a chiropractor. And he said, no. He said, come and look at these books. And on his shelf, he had books by Cyriax, Marlin, and Manel. And I looked at those books, and I started reading them, and after about a month, he said, are you really seriously interested in this work? I said, yes, we need it in physical therapy. He says, okay, when you get through school, I'll send you to England and do things like that, and you'll be able to teach this when you come back. That's how it started.
Fantastic. And then later on with Freddie Clayton-Bourne, how?
Well, I studied with Clayton-Bourne in 1960 when he was living in Norway, and visited him. I had great letters of introduction from the Works Compensation Board of New Zealand. They gave me references. I treated the chairman of the hospital board who fixed his back with a rather scary Cyriax maneuver that I learned from the textbook. So I got letters from very significant people, and at the age of 23, I was visiting people like Clayton-Bourne because the letters went ahead. We made arrangements, Stoddard and Cyriax in London, and worked with most of the year. I spent time with those people trying to learn their different methods and particularly their diagnostic techniques as well as how they applied that in practice that followed. So that's how I met those people. And then it was just a few years later, I got back to New Zealand. Had a lot of opposition there. Chiropractors sued me. My own faculty wouldn't support manipulation being part of the physical therapy program, so the medical school hired me and appointed me to the physical therapy school, but that didn't make me very popular. So I thought I would go to America, get a PhD, and come back and be unquestionably the best qualified therapist, and perhaps one day I'd become a principal of the school. However, things happened in America that delayed my studies and divorce and stuff, so I got stuck in America, if you wish, but I've kept my contacts in New Zealand and tried to contribute, and I think you mentioned the honorary fellowships and things that have come out of that. So it was 1967 that I felt we needed to get together, people like Maitland and Grieve, and Carlton-Bourne, McKenzie and myself and others, and organize this work in an environment that would allow us to share what we knew, to bring it along in physical therapy for the benefit of our patients. So 1967 was a meeting in London. We all met, a bunch of us. McKenzie wasn't there, but the other names were, and some additional other people. We decided to set up an international body, and that took place 7 years later in Montreal, Canada. I was the founding chairman of the International Federation of Orthopedic Manipulative Therapy, now Manipulative Physical Therapy. And the two big issues were, are we just to be an environment for this exchange of ideas, in other words, a conference, or are we to be a membership body by examination standards? I was very concerned that attention to standards would perhaps tear us apart, because I saw big differences between people like Maitland and Carlton-Bourne. But they got along well when they got together, and they put those differences in style and technique aside in the common desire to have a body that would advance our field. So we have both standards and we have conference in IFOMPT, and it's been very successful. I think now that we've got some 25 countries as members. New Zealand and Australia were two of the founding members, and so was Canada, Norway, Sweden. I think that was it. America might have been, but we weren't really qualified because we didn't have standards at that time. We now have them through our academy.
Starting to wrap things up, is there any exciting work happening at St. Augustine that we should keep an eye out for?
Well, I think one of the most exciting developments right now is that we're the first school that allows a student to have a dual degree. They can graduate from here with a master in occupational therapy and also a doctorate of physical therapy. And they don't have to repeat anatomy and physiology. They just go right through. That's a growing program. But now we've added the orthopedic physician assistant. The physician assistant program, as you know, is a 2-year program. It's now moving to the master's level. But most of many of the programs don't even have an orthopedic rotation. So what we're doing here at the University of St. Augustine is we're doing an orthopedic physician assistant. We'll have a year in class doing orthopedics, theory, anatomy, physiology, and so on. But then a whole year out on clinical affiliations where they only do orthopedics. So to an orthopedic surgeon, these will be the physician assistants that they would like. Now, we're making it possible for occupational therapists of our school and physical therapists to also take that degree, that master's in orthopedic physician assistant, without having to repeat the anatomy and physiology and other basic courses like imaging and so on that they've had as physical therapists. I think this is an exciting development, and I think we'll do very well with it. It's the only one in the country. It's orthopedic physician assistant, not to be confused with a regular physician assistant.
Yeah, very interesting. And then finally, could you just tell us a little bit about your postgraduate continuing education certification in the manual therapy program, and if someone was interested in finding out more information, how would they find out more?
Well, they can go on our webpage, usa.edu. University of St. Augustine is usa.edu, and they can find out a lot there. But the manual therapy certification, we've been running since 1981. There's some 1,600 people through it. There are 4 courses on the spine, 2 on the extremities, and 1 on myofascia. And then they come for a week. They're about usually 3 to 4 days length. Most of those are done over weekends, of course. And then they come to a week review and testing, oral, practical, and written. And that's a tough testing process, but the process has earned respect over the years, and it continues to grow. So we're very happy with that. And we haven't changed our standards at all in the years, but we keep adding new literature and evidence-based material as it comes available to us. But really, there's very little in what there is out there supports, of course, the practice of manual and manipulative therapy, and we're pleased about that, of course.
Absolutely, and I'll put a link on the website to that as well. And I guess, just a little bit off topic here. Any further English Channel swims in your near future?
Yes, I'm swimming again in July.
Oh wow!
Mid-July and mid-August and early September. I have 2 dates for next year, and I'm training for them now. I'm working mainly on core strength right at this time, and building up muscle bulk. I'm trying to increase my weight from 180 to 200 pounds. And soon I'll start aerobics, and by February I start swimming, and I hope to nail it. I'm the oldest person to have tried to swim the channel. If I succeed, I'll be the oldest by more than 3 years.
Wow. Well,
that's the schedule for taking up my next year.
Absolutely.
Listen, I want to thank you very much for the interview.
Oh, you're very welcome.
It's been helpful to you. I certainly have enjoyed it, and I wish you well in your enterprise.
Thank you very much, sir. And we hope you've enjoyed the interview. For more great interviews, please visit us at physicaltherapycontinuingeducation.org. That's physicaltherapycontinuingeducation.org.